Hey everybody, and welcome back to another video here at Whiteboard Doctor. Happy Saturday, one day delayed classic. Coming to you today with a topic that has been requested by a number of you. It's a topic that actually has crept into the news even more over the last 24 hours, and that is Marburg virus, a cousin of Ebola, which may sound more familiar to many of you. So we're going to do a deep dive on Marburg virus. Also, should we be worried about it? What are all these news headlines? Let's understand them better. A couple matters of business. As a classic shout out, we've covered a handful of different diseases over time. We'll link some of them in the video description, things like bird flu, obviously COVID. We covered a brain-eating parasite, Neigleria fowleri, many things. So check that out in the video description and pinned comment if you're interested in any of those other topics. Second matter of business, something we're excited about, and it sounds like a lot of you may be excited about it as well. In our community section of our page, we posted a poll the other day about something we've been thinking about, and that something is an email newsletter that would allow us to communicate with you all, share interesting things with you through email more frequently. At first, we were thinking maybe twice a month, coming out on the 1st and the 15th. But it would allow us to share more with you in a non-video format, provide you with additional information. For instance, things on updates on COVID, updates on health and wellness, updates on studies you should know, learning new diseases, that type of thing. So let us know in the comments or go to our community section on our page and fill out that poll, because we think we probably are going to come out with one, and we would love for as many of you to be on there as possible, prompt some good learning and discussion and things. We're working on the logistics of that, figuring out exactly how we want to do that in terms of the software we're using, et cetera, because we obviously want to make it an optimal type of sign up and logistics for you all. So stay tuned for that and let us know what you think. No further ado, 30-second break for introduction. Don't go anywhere though. We'll be right back. Hello everyone, and welcome to another video here at Whiteboard Doctor. Thanks for joining us today. Here at Whiteboard Doctor, our mission is to provide you with free, interesting, relevant, understandable medical education and news for all types of lifelong learners, trainees, and practitioners. We have weekly videos that we debut Fridays at 5 p.m. Eastern Time with bonus medical education videos posted throughout the week. We'd love for you to join the Whiteboard Doctor community and follow along by hitting the subscribe button located in the bottom right-hand corner. We also encourage all likes and comments, even if it is just to say hello. All our video descriptions contain links for additional related videos that might be interesting, so don't forget to check those out. And lastly, a quick disclaimer, none of these videos are intended to be acted upon as medical advice. Please pause the video here and read this disclaimer in its entirety before moving on. With no further ado, stay well, keep learning, and let's get to the video. All right, thanks for sticking around. So Marburg virus, Ebola's cousin, causing a stir. What is the virus, the disease, symptoms, transmission, different outbreaks, treatment, and prevention? So this is something that people requested in comments and videos over the last couple weeks. And when we started doing research on it, we noticed that there was actually a huge increase in news articles talking about this. This is taken from today. And you can see all of these different news articles with these headlines. Some of them are, more quote-unquote scary than others. But CDC warns doctors to watch for Marburg virus. Marburg virus. CDC warns U.S. public officials. What is the CDC Marburg virus outbreak advisory, et cetera, et cetera? You can see a ton of these headlines just Googling, medical news or Marburg virus or what have you. So we're going to dive into what this is to let you guys better understand what these headlines mean. So Marburg virus, one of its creeps into fame. The reason that people are so cognizant of it is actually a cousin of the Ebola virus. And many of you may recognize that name. For those of you that don't, Ebola virus has actually caused tens of thousands of deaths in Africa during different outbreaks, and a number of deaths in countries outside of Africa, such as the USA, the United Kingdom, and Spain. And Ebola virus causes this umbrella term known as viral hemorrhagic fevers, which sounds scary, and if you get very sick with it, it can be scary because quite literally, at its worst, you start bleeding from all your different orifices. There's blood in your vomit, blood in your stool. You can get blood from your gums, your mucous membranes, all sorts of stuff, and we'll get into that a little bit more. But Marburg virus is actually a virus related to Ebola that also causes these viral hemorrhagic fevers. All right. Ebola virus has caused a number of outbreaks in the past. We could actually put out a video on Ebola virus as well if that's something you're interested in. Let us know in the comments. But Marburg virus, as we'll get into, hasn't caused as many outbreaks and as large, except now there are currently some to be discussed. So news headlines, as we talked about, we'll link some of these in the video description if you wanted to peruse them. But a lot of it is about the CDC warning doctors, and that's one of the things we're going to focus on later on in the video. So what is Marburg virus? Let's do a kind of a dive here on what exactly this virus is so we can better understand the context of a lot of these news headlines. Well, it's from a family of viruses known as the Filoviridae family, and that is the same family of viruses as Ebola, which is why we said up top that they were cousins. So they're part of the same viral family. Something interesting, probably not super relevant to many of us, me included, is that the virus is a pleomorphic shaped virus. So when we talk about viral shapes, we sometimes talk about rods, we sometimes talk about these hexagonal shapes. They're sometimes round. Well, Marburg virus is actually pleomorphic. It can have multiple shapes: round, branched, filamentous, more. A lot of the pictures you'll see of Marburg virus has this kind of branched virus where there's some clumps in it, but it's kind of this branched filamentous shaped rather than just a single shape. So something kind of interesting. When we think of Marburg virus, it causes the disease that is conveniently named Marburg Virus Disease, abbreviated MVD for Marburg Virus Disease. And the symptoms of this disease vary over time. So when you get exposed to someone with Marburg virus, and we'll get into exactly how that might happen, the incubation period, the period of time the virus might stay in your system before you manifest symptoms, is often quoted at 2 to 21 days. So you might only have the virus in your system for 2 days, but it also could be as much as 21 days later, which makes it a little challenging, right? Because you start to get sick, you don't think, well, what was I doing 3 weeks ago? You think much earlier than that, what was I doing in the last week? But the incubation period can be quite long. After you start to develop symptoms, your initial symptoms tend to be this sudden onset, this acute onset of things like severe fever, headaches, myalgias, which are muscle aches, chills. Now, they are sudden and often significant, but if you look at these symptoms are consistent with a lot of viruses. Flu can cause fevers, chills, muscle aches, headaches. COVID certainly can. A whole slew of different viruses can cause these initial symptoms, so they're very non-specific. So you might think, oh, I have flu, I have, a different virus. I wouldn't initially think Marburg virus, nor should you, right? It's very rare. You shouldn't be thinking you have Marburg virus. You should be thinking you have one of the much more common viruses. But the point being that the initial symptoms are fairly nonspecific, and the incubation period is quite broad, which can make it difficult to pin down the diagnosis early on. You then start to get more what we'll call kind of stereotypical, or a word we use in medicine would be pathognomonic, which would be that those symptoms or that finding is diagnostic of a certain disease. In this case, it's not quite pathognomonic, but you start to get symptoms that are much more suggestive of Marburg virus. One being this prominent truncal rash. People start to report it's not itchy, it's red. It's kind of this maculopapular, we call it. So this kind of blotchy red rash, often on your trunk, chest, back, upper arms, upper legs. And you might at this point also get nausea, vomiting, diarrhea, sore throat. And this usually starts around day 5. So you develop these initial symptoms, then 5 days later you start to get nausea, vomiting, diarrhea, a prominent rash on your chest. And people have described this phase as ghost-like because they say patients tend to they look very unwell, they look pale, they look like they have sunken eyes, they're very tired, they're kind of in this ghost-like state because of how sick they're becoming. But some people, the illness stops here. And that'd be a great thing because those that get severe disease progress next to what we call multi-organ failure. Their liver might start failing, their kidneys might start failing, their lungs, they might have to go on the ventilator. They get very, very sick. They can go into shock. And then they develop the massive hemorrhage. Classic for, if we scroll up, the viral hemorrhagic fever term. So they start to get massive hemorrhage where they start bleeding from, it sounds spooky, and it is, all their different orifices, their nose, their gums, their feces, so their bowel movements, vomit, urine, vaginal bleeding. You start to get bleeding from all your different orifices, and that's very, very, very bad. That is the severe form of Marburg virus disease, why they call it the viral hemorrhagic fevers. You get fevers and you start bleeding. So those are the symptoms of the disease, but how do you get the disease? How did humans get it? Where is this disease hiding out? There's not a lot of cases. It pops up randomly. So how does it exist, right? Because if it's not constantly spreading between humans, it has to be somewhere for it to get to humans. And the answer to that is actually bats. So it's what we call a zoonotic disease, meaning that it's kind of a baseline circulating within an animal population. In this case, bats, specifically a fruit bat native to Africa. And the fruit bat populations don't really seem to get sick from it. The virus just lives in the fruit bat, spread between fruit bats. Fruit bats do okay with it. And that is the baseline population. That is the reason that Marburg virus can exist, because it circulates within bats and then just occasionally jumps. And it can jump to both humans as well as primates, non-human primates, seen here. And the challenge is that once it gets into humans, it actually can circulate within humans. There's human-to-human transmission. So oftentimes humans get it by being around bat excrement, being around high populations, high densities of bats. It doesn't seem like this is like a bat has to bite you and then you get it. You could just be around densely populated areas with bats. Obviously, that's the specific bat is this fruit bat native to Africa. It's not just any bat. And then that virus can sometimes jump into humans. And once it does, it can circulate within humans itself for that human-to-human transmission. And the human-to-human transmission occurs in a certain way. It is not droplet or airborne like a respiratory virus. So if we think COVID-19 can spread droplet and airborne. You can sneeze and someone can inhale your sneeze and get COVID. Or you can breathe out a bunch of particles and someone can inhale those particles. Or you can sneeze on a doorknob and someone puts their hand on the doorknob, gets the droplets on their hand and then rubs it in their eyes or their mouth or picks their nose or something. Same thing with flu. The way that Marburg spreads, though, is different. It's actually through contact with an infected person's body fluids. So this is, you have to come into contact with someone's body fluids, including things like urine, their sweat, their feces, saliva, their vomit, a mom's breast milk, semen, so you can get it through sexual contact. And the infected person body fluids most often have to actually contact your broken skin or a mucous membrane like your eyes to infect you. So this is not as transmissible, I guess the more proper phrase would be that you don't just get it randomly, like breathing in someone's air. It's most often spread through contact with an infected person. And we saw a few articles that said that that person has to have symptoms to spread it to someone else. They can't be in that 2 to 21 day incubation period. They have to have symptoms, although we couldn't verify that with every source. The other challenge, though, is they have seen transmission with objects contaminated with body fluids. So let's say that someone vomited on a doorknob who had Marburg virus. You then touch that doorknob and you rub it in your eyes, a mucous membrane. You could get Marburg virus. So person-to-person contact with body fluids, most often on broken skin or mucous membranes, such as the eyes, or objects contaminated with body fluids from an infected person that then you get on your broken skin or mucous membranes. Another interesting thing is it actually is the virus can persist in. It's been found in people who have healed from Marburg virus for months afterwards. Most often quoted to be surviving their testicles or their eyes, and they can be contagious. There's been reports of people who have caught Marburg virus from a person who healed from it months beforehand, and then were still able to give it to another person because that virus kind of survived within their body. Obviously, this is not common. It's a very small percentage, but it is possible. And the CDC, this is a direct quote from the CDC website. We'll link in the video description, obviously. Those at highest risk of exposure to Marburg virus are those that come in close contact with this African fruit bat. And this is the scientific name for the specific fruit bat, Rosetus aegyptiacus. Native to Africa, and it's the reservoir host, as we talked about. It's the animal that the virus lives in, typically with occasional jumps to human. And it's coming into contact with them or their urine or their feces, so you don't have to get bit by them or anything like that. In addition to that, anyone exposed to a person sick with Marburg virus or a non-human primate sick with Marburg virus. In fact, Marburg virus, I think, was first identified in 1967 in Marburg and Frankfurt, Germany, hence the name Marburg virus. And it was discovered in a lab that was looking at monkeys with illness and, dissecting their tissues and things like that. And those people actually caught Marburg virus from coming into contact with infected non-human primates that they were working on in the lab. So then, can you treat it? Unfortunately, the treatment is all what we call supportive care. And what supportive care means is there's not a medicine we can give you that just kills the virus. There's not an antiviral. All right, so there's no antiviral medication. There's no vaccination against it. We just support your body while your body tries to fight it off. And the mortality often stated is like around 88%, but there's variability here. Most people who look at this say it's anywhere from 20 to 90%, depending on who gets it, what country they get it in, when it was diagnosed, does that country have good access to care, to medical care in a timely manner. And the 88%, the higher mortality is often seen in African countries where some people don't have easy access to good medical care, depending on where they live, et cetera, et cetera. So more like 20 to 90%, depending on where you live and when it was diagnosed and blah, blah, blah. So if we look at cases to date, I think that can be informative, right? Because we want to know, has it been spreading a ton in the past? And the answer is, it hasn't spread that much, but there have been small outbreaks. All right. So the first one, as we talked about, 1967, Germany, Yugoslavia. This was a lab outbreak before they had discovered it. This was when they discovered it. There's 29 people who got it and 7 died. So a mortality rate of 24%. 2 people in Yugoslavia got it that year as well. None of them died. And then we see a lot of African countries, South Africa, Kenya, Democratic Republic of Congo, Angola, Uganda, from 1975 to 2007, so over the last 3 decades. And you can see the mortality rates have ranged from 30 to 100%. All right, the 100% was just one person got it in 1987 and that one person died. The bigger outbreaks, though, are right here with mortality rates around 80%. So Democratic Republic of Congo, there was an outbreak in 1998. 154 people got it, 128 died. In Angola, there's an outbreak in 2005, 374 people got it, the biggest outbreak, and 329 unfortunately died. There was a case in 2008 in the United States, but it was someone who came from Uganda. No one else caught it. Netherlands, someone who came from Uganda also in 2008. One person had it, that one person died. Another outbreak in Uganda, 2012, Uganda 2014, Uganda 2017. So lots of outbreaks more recently in Uganda. And the mortality rate's been super variable from 100% to 27%. All right. And these are all smaller outbreaks. So I think the important thing to note is there have been outbreaks of Marburg virus many times in the past, right? 1, 2, I don't even want to count, but probably around 15 times in the past. And almost all of them are very small. 1 person got it, 15 people got it, 4 people got it, 2 people got it. The highest ones were, low hundreds, 374 people, 154 people. So it has never spread massively. Ebola was tens of thousands of people during one of its bigger outbreaks. So this Marburg virus has had outbreaks in the past, but has never spread significantly, which is reassuring. Now, viruses mutate. A lot of this is a product of the populations that it was first identified in, and if it's easy to spread in those populations, et cetera, et cetera. So not to say that there couldn't be a bigger outbreak, but the historical support here would suggest that outbreaks, when they happen, tend to be quite small and contained. And you have to get it from contact, whether it be human to human or contact with an infected object in a timely manner. It's not, droplet or airborne. You can't sneeze on a packed bus and then give it to 20 people. So why then is the CDC warning people? Why are all these, we're going to scroll up, why are all these news headlines saying, oh, CDC warns, CDC asks doctors, CDC warns outbreaks in Africa, blah, blah, blah? Well, it's really because of these two outbreaks. In late January, Tanzania said that they had 8 cases of Marburg diagnosed, with 5 deaths. And just like anything, there's probably a few more than this, right? You can't test every single person who may have had it, or maybe they could, depending on where the outbreak was. And then in Equatorial Guinea, in January, February, there's 14 cases and 10 deaths. So significant mortality rate here. 5 people died out of 8, 10 people died out of 14, but still small outbreaks. This one was a couple months ago, and then this was just last month, obviously. Most people think these were 2 separate animal to human jumps. They don't think they're connected. That someone went from Equatorial Guinea to Tanzania and spread Marburg virus. They think it was 2 coincidental outbreaks where it jumped from an animal to a human, a bat to a human, and then it traveled within the human to human, and unfortunately a number of people died. But what the CDC is saying is not that they think there's going to be some big outbreak in the United States, and I'm sure other countries outside of Africa also are stating similar things. They're just saying for anyone working at the hospital, if there's a traveler who is coming from one of these countries, Tanzania or Equatorial Guinea, and they have symptoms that could be consistent with Marburg virus, just be cognizant of that it could be Marburg virus and take the appropriate precautions. Because as we saw previously, there have been people who have traveled from a country with cases, right? Netherlands, United States, someone traveled from Uganda and unfortunately had Marburg and died there. So they want people working in the hospital just to note, if someone comes, they travel to one of these countries or a neighboring African country, to just be cognizant of that, especially if they have symptoms that it could be Marburg virus. They're not saying that they're expecting some huge outbreak of Marburg virus, but they want us just to note and do kind of a closer travel history and those types of things when someone presents with symptoms that could be consistent with Marburg virus disease. So anything can happen. My opinion would be that this isn't something that's going to cause some massive, humongous outbreak in the United States or other countries outside of Africa. I certainly hope it doesn't cause a big outbreak in African countries either, but they unfortunately are the highest risk just because that's where those fruit bats are native to, and we'll keep an eye on it. Hopefully this was informational, interesting. It's a interesting disease, which, as we say in medicine, it's never a good thing to be interesting because it means it's causing unique and sometimes terrible things, such as hemorrhagic fever. But it is an interesting disease. So hopefully it was educational. Hopefully you can better understand a lot of these news headlines. There most likely will be more news headlines as the days go on, as there typically is. And hopefully this provides you with some way to digest that information, discuss it with friends and families, those types of things. We appreciate you checking out the video. Give us a like, leave us a comment, subscribe, hit the bell button, all that good stuff. Check out our other videos, our other pages. We hope we see a sign up for the newsletter as well once we get that live. In any case, stay well, keep learning, and we'll see you all next time. Happy Saturday.